Section 1. The Turning Point. Why day 3 to day 5 is a critical window. The first days after you give birth are a whirlwind of emotions, learning, and immense physical change. While you are focused on your new baby, your own body is undergoing one of the most rapid transformations it will ever experience. The period between day 3 and day 5 postpartum is particularly significant. This is a crucial turning point where your body begins the intense work of returning to its non-pregnant state. During pregnancy, your total blood volume increased by as much as 50% to support your growing baby and placenta. Now, with the baby delivered and the placenta gone, your body must figure out what to do with all that extra fluid. This massive fluid shift is a monumental task for your system. The extra water that was stored in your tissues begins to move back into your bloodstream, ready to be filtered out by your kidneys. This process, called diuresis, is why many new mothers experience night sweats and a sudden dramatic increase in urination. Section 2. The Hidden Infection. How a Postpartum UTI Begins. Illustration. Female urinary tract showing bladder and urethra with arrow indicating bacteria travel. While your circulatory system is busy managing fluids, another part of your body is recovering. Your urinary tract is recovering from its own unique challenges of labor and delivery. A urinary tract infection, or UTI, is one of the most common infections after giving birth. One of the most frequent culprits is the use of a urinary catheter. Many individuals receive a catheter during labor, especially if they have an epidural or during a cesarean section. Inserting a tube into the bladder can inadvertently introduce bacteria into a normally sterile system. Even without a catheter, the mechanics of childbirth can make the bladder more susceptible to infection. That pressure can cause temporary numbness or loss of bladder sensation. You may not get the usual signal that your bladder is full and needs emptying. Urinary stasis, urine sitting in the bladder, becomes a breeding ground for bacteria. The area around the urethra can have tiny tears or soreness after vaginal delivery. That trauma can make urination difficult or painful, causing incomplete emptying. It can also create a breach allowing bacteria to ascend into the urethra and bladder. Symptoms can be tricky. Burning when you pee, urgency, lower abdominal cramping, sometimes a low-grade fever, or a general feeling of being unwell. Section 3. The Pressure Problem. Understanding postpartum hypertension. High blood pressure after childbirth is a serious concern. It can arise for several different reasons, even if your blood pressure was normal during pregnancy. One critical condition to rule out is postpartum preeclampsia. It can develop in the days or even weeks following delivery. It involves high blood pressure plus signs of organ stress, protein in the urine, abnormal liver function, or abnormal kidney function. Preeclampsia can begin after delivery. Vigilance is essential. Beyond preeclampsia, blood pressure can rise from physiological shifts after birth, as a massive volume of fluid moves from tissues back into blood vessels. Think of it like adding more water to a fixed system of pipes. The pressure goes up. Often this is temporary. Kidneys will excrete the excess fluid. But the process can be complicated by pain, stress, and sleep deprivation. Pain and emotional stress release hormones like cortisol and adrenaline. Those hormones constrict blood vessels and speed the heart, raising blood pressure. An infection such as a UTI can also directly raise blood pressure. The body's inflammatory response can constrict vessels, raise heart rate, and fever signals significant stress. So a doctor seeing a new mother with high blood pressure must consider underlying infection. Don't dismiss any single symptom in isolation. They may be linked. It could be a UTI driving inflammation and BP, or two coexisting issues. A simple UTI and developing postpartum preeclampsia. Disentangling these is the medical team's critical work. When a new mother presents with a potential UTI and a spike in blood pressure, healthcare providers act quickly to get a clear picture of what is happening inside the body. The diagnostic process is a methodical search for clues. The first and most important step is often a urine test. A simple urine dipstick can show white blood cells, red blood cells, and, crucially, protein. A significant amount of protein in the urine is a hallmark sign of preeclampsia. A urine sample is also sent for a culture to identify the bacteria and which antibiotics will work. Simultaneously, doctors order blood tests to see how organs are functioning under stress. Platelets, kidney function via creatinine, and liver enzymes. Abnormal results can indicate the high blood pressure is affecting organs, suggesting preeclampsia rather than just infection. Throughout this process, blood pressure, heart rate, temperature, and oxygen saturation are monitored frequently to track the body's response. Once a diagnosis is made, the treatment plan is tailored to the cause and often addresses both issues. For a UTI, antibiotics safe for breastfeeding are prescribed immediately. For high blood pressure, the approach depends on severity and cause. If hypertension is mild and likely a reaction to pain or infection, treating the UTI with antibiotics and managing pain with acetaminophen or ibuprofen may normalize blood pressure. If blood pressure is significantly elevated or preeclampsia is diagnosed, doctors prescribe short-term blood pressure medicines safe for breastfeeding, such as labetalol or nifedipine, with close monitoring and possibly a short hospital stay. Navigating the postpartum period can feel overwhelming. It can be hard to know what is normal versus a real problem. Be aware of specific red flags that need immediate care. Do not hesitate to seek emergency care if you experience any of the following: a severe headache that does not get better with simple pain meds, blurry vision, seeing spots, or flashing lights. Severe upper abdominal pain, especially under your right ribs. These are classic signs of severe preeclampsia. Urgent evaluation needed. Other critical warning signs: sudden significant swelling in your face, swelling in your hands, swelling in your feet. A high fever with chills, any difficulty breathing, or chest pain. These are your body's loud alarm bells. Listen and act quickly to protect your health. Good news: UTIs and postpartum hypertension are very treatable when caught early. Safe antibiotics can clear infections, and reliable blood pressure meds are usually compatible with breastfeeding. Key: prompt recognition and communication. You know your body best. If something feels wrong, it probably is. Don't tough it out or avoid being a bother. Your health matters as much as your baby's. You are not alone. There is a clear path to getting better. If you feel unwell or worried, do not wait. Call your midwife, call your doctor, or visit urgent care. Seeking care early is the best thing for you and your family. Your well-being matters.